Okay, during last week, week 2 this year, which ended on the 16th of January last Sunday, we had a slight decrease in influenza activity. Our Sentinel GP influenza like illness consultation rate was 173 per 100,000 in week 2, which is a decrease from the updated rate of 200.8 per 100,000 reported during the previous week, week 1. The influenza-like illness rates increased significantly, however, still in the younger age groups, in the 0 to 4 and the 5 to 14-year-olds. And the rate in the 0 to 4-year-old was 213 per 100,000. This is still very much below the peak, though, for young children that was seen in the pandemic, and the peak was 387 in 0 to 4-year-olds. The rate increased again in the 5 to 14-year-old age group, but again, this was very much below the peak that was seen during the pandemic for this age group. The other point to emphasise is that we were still seeing quite considerable hospital activity during last week, and 222 people were hospitalised last week with influenza infection. And this was slightly above the week that we had seen before, when we had 217 people hospitalised during week 1. The labs noticed a decrease in the percentage of samples that they tested being positive for influenza, and that is an encouraging sign. And coupled with the decline that we've seen in the overall peak, we're hoping that this would indicate that over the next couple of weeks that the flu activity would start to fall. Unfortunately, we have been informed of a total of 6 influenza deaths. 5 of these have been from pandemic flu A H1N1 2009, which is swine flu, and we have had 1 death reported in a patient from influenza B. 1 death was in a patient aged 0 to 4 years. We've got 2 deaths in patients aged 15 to 64, and 3 deaths in patients aged above the age of 65. 5 of these deaths have occurred in people who have had underlying medical condition. 1 of death occurred in week 52, 1 in week 1, and we've had 4 deaths reported in week 2. That's the weekend of last Sunday.
Hospitalisations and ICU lag behind what the GPs see and what happens there. So the deaths lag behind as well. So our deaths, you will hear them building up over the next number of weeks. It's just the way the system is. There's always a lag there, okay? So you won't get the full picture of the deaths until some time after this is all finished, whereas the data around the hospitalisations and the ICU and GP activity is much more contemporaneous, okay? So it's just important to note that. We know the number of deaths will rise, but it's not anything changing, it's just the way that that reporting system happens.
You will be aware that the National Immunisation Advisory Committee, which is an independent committee of experts, met during the week to review the advice for pregnant women in relation to seasonal flu vaccine. The decision that they reached was that they recommended that all pregnant women should get seasonal flu vaccine, and that included any woman who had previously had the swine flu vaccine, either last year or this year, because there was a temporary shortage of seasonal flu vaccine. But the reason that it has been made is because we know that pregnant women are at risk of the complications of swine flu. We knew that from last year. But there is also evidence that pregnant women are at risk of complications of the B strain of flu, and that is one that is contained in the seasonal flu vaccine. And that is the primary reason that the advisory committee has made its recommendations.
So finally, as ever, the big issue about flu is how to prevent it. So vaccination's there, but then it's about how we ourselves act. And as ever, it's our classic message about catching it. If you sneeze into a tissue preferably, put it in the bin it, and then kill it by washing your hands and things of that nature. So it's very important that people do that. Even if our numbers are falling, we have to recall there'll still be people getting ill in those weeks. It's not as if it's gone away. Suddenly when it's peaked, you don't think it's gone away. It's not like a cliff. It's a mountain. You're going up the side and you're going down again. So there'll be still a fair number of people getting ill in those weeks. So even if we have peaked this week, there'll still be 3 or 4 weeks of large numbers of people getting ill with the flu and putting pressures on our system. So it's not gone away in that sense. Really, it'll only, if this is the peak, it will only really have gone away in 4 or 5 weeks' time. So that is a very important issue. So our messages are still very important. All those messages about prevention and vaccination still hold true for the next few weeks. Okay?
Just to go back about the immunisation of healthy children, the expert committee considered this at the start of the season and has also discussed this issue more recently, and will discuss it again in the future if need be. But the issue is, as Dorita said, we reckon about 50% of children, school-going children and children under 4 years of age, received the flu vaccine last year. That's the swine flu vaccine. We also know that a number of children were infected with swine flu last year. So the level of immunity, many children in the community have some protection against swine flu. And the expert group considered this, and their recommendation was that only children in the at-risk groups, that's those with long-term medical conditions, long-term heart disease, lung disease, cystic fibrosis, etc., should get the seasonal flu vaccine, but that it would not be extended to the general population. When we're talking about pregnant women for the vaccine, we're also including women up to 6 weeks after giving birth as well. So it's just important to note that, because their immune systems haven't returned fully to normal, they're still at risk. And the other aspect is just to say that by giving the vaccine to pregnant women, you will also protect their unborn child, and you will also confer protection for the baby up to 6 months of age. You can't vaccinate babies under 6 months of age, so this is the one way of also protecting babies as well.
Thanks a million, everyone, and thank you to the speakers.